New breast cancer screening guidelines have a lot of women very confused. It's even causing debate between medical experts. The American College of Physicians is now recommending that women start breast cancer screening at age 50, not at age 40. It also recommends following up every other year as opposed to every year. And these recommendations are sparking a lot of debate amongst the experts and physicians. And joining us this morning is Dr. Scot Ackerman with the Ackerman Cancer Center. Thanks so much for being with us this morning. I mean, we women are just throwing up our hands saying, what are we supposed to do? We've heard for so many years that you get your first mammogram at 40. So why the change?
Well, what we have found in the late 80s is when mammography really became more prevalent, and we knew that mammography saved lives. And between the 80s and now, the screening mammograms that we've been recommending to be done every year at age 40 have actually saved thousands of lives. What we've also found is that a lot of women undergo unnecessary procedures because of false positives. A lot of women have a lot of anxiety that's associated with that. And a lot of women wind up having unnecessary surgery because there's frequent mammograms. So we're looking at it, and we're saying, well, you know, maybe women don't need to have it as often as they've been having and as young of an age as they've been having, because breast cancer frequently isn't diagnosed a little bit later in life, and younger women have more dense breasts. It's hard to evaluate. And so a lot of entities have been rolling back the recommendations a little bit. The U.S. Preventive Services Task Force, as we heard last week, the American College of Physicians have all kind of rolled back a little bit as to not overdo it with too many mammograms. Well,
and I was in an interesting situation in that my primary care doctor had a different recommendation from OBGYN. So if you find that your own doctors are not agreeing, I mean, what's the best way for a woman to find out what's best for her?
Well, a lot of these recommendations, for instance, the American College of Physicians recommendation is for physicians. It's not really out there for the general public. They're recommendations for physicians to engage with their patients, have a discussion at age 40. What I recommend to women is look at their risk factors, and you could find there's all sorts of risk factors, and if you're of average risk, then I think it's okay waiting till 45 or 50 to get your first mammogram, and it's really okay doing it every other year, as long as you're doing it every other year. But if you're above average risk, so for instance, if you're African American, or if you have a family history of breast cancer, or if you're on hormone replacement therapy, or if you're obese, or if you eat a high-fat diet, all those things increase your risk of breast cancer, then I think you should have some pause and have a conversation with your physician about doing your mammogram earlier, like 40 or 45, and maybe doing it every year.
And I worry, too, because anyone who's had a mammogram does not enjoy it, and I just worry about more reason to skip doing it. But you've got to make sure that at the very least you do it every other year.
Right, well, that's the concern. The concern is that when we recommend it to be done every year, even though we have good compliance rates, still women miss a year here and there. So now if we recommend it every other year, we'll be lucky if we get every third year. So that's why I personally prefer the every year recommendation, just to get a higher level of compliance.
Okay. And family history, of course, extremely important.
Well, one concern is not just family history, but other risk factors. For instance, there's racial disparities in breast cancer death rates. We see that African American women are diagnosed at a younger age and have a higher death rate due to breast cancer. And so there's a concern that having this just broad recommendation starting a bit later might increase these disparities, because African American women, if they don't get their mammograms at an earlier age, a lot of cancers will be missed.
Bottom line, though, get them when you qualify.
Right, and have a conversation with your physician about what's important for you.
All right, Dr. Scot Ackerman, thanks so much for being with us this morning and helping us diffuse this confusing situation.
I hope I did.
You did.